The reason that it's important to test vulnerabilities is because we really don't understand how it is that people fall through the cracks in the healthcare system. It's very clear to us that, broadly speaking, that especially non-communicable diseases are significantly mediated by sociocultural factors, by socioeconomic factors, and by people's capacity, their capabilities, their opportunities, and their motivation as it relates to making changes in their lives, because so much of non-communicable diseases is mediated by human behavior. And so understanding what it is that motivates people, how their opportunities influence their decision making, and how they become capable and incapable of actually affecting their destinies is a critical part of understanding non-communicable diseases and how we address them. So where does vulnerability fit into that? Well, we have to understand that simply providing people with information doesn't necessarily mean they can make use of that information. And unless we understand how people are limited in their actions by local circumstances, many of which are beyond their control, there's really no way that we can expect real change to take place. The second part of this is that in new and emerging environments, especially in moments of instability, whether those instabilities are caused by natural disasters or by political disruptions or wars, or simply by the slow accretion of more and more people to urban areas that create different kinds of instabilities that mediate how people get by, traffic patterns, safety issues, eating habits. Unless we understand who the most vulnerable people are, we don't really have a foundation on which to make changes that are lasting and that actually can have a profound effect upon society. So that looking at vulnerability allows us to tap into the silent populations that otherwise we would never be able to identify. And what a vulnerability assessment does that other forms of social interaction often don't do is it acknowledges from the beginning that there are going to be populations that don't have the social capital to actually speak for themselves. To give you an example, in the United States, we did a study over 5 years of rural communities that were very much in need of medical attention. And what we found was that the communities that had physician shortage designations, where the national government acknowledged that these communities were in need, weren't necessarily the most needy communities. The most needy communities were the communities that didn't have the opportunity to form social groups that would allow them to get that designation. And that's where being vulnerable can often compound the effects of an illness and create conditions out of which it's very difficult for people to climb. And so by doing these assessments, we hope that we can understand better how the lives of people influence their ability to make changes in them, and also through looking at multiple examples of vulnerability to understand how it might be possible to present people with options that are real to them that they haven't thought of. The Cities Changing Diabetes Project, this is a really incredibly exciting opportunity for international collaboration. It's a project that has been galvanized unusually by a pharmaceutical company, Novo Nordisk, the Danish pharmaceutical company, which in many ways is not a typical corporation insofar as the majority of the shares in the corporation are actually owned by a trust, not by shareholders, which is to say that it's not a corporation that could be easily taken over by investors as a way of maximizing profit at the cost of social engagement. And what this has led to is an opportunity for them to support Cities Changing Diabetes project, which actually is their idea. We've come on board because they are allowing us to be a part of this and actually to own all the intellectual property. Everything we write, whether it's positive or negative about the project, we can say. We don't have to have anything approved in advance. It gives us a great opportunity to work in new and emerging megacities around the globe, and in this initial phase of the project, there are 5 of those cities. The only one that's not a megacity is Copenhagen, which is where the corporation, where their home base is. But it gives us an opportunity to work collaboratively in each of these locations with the most interesting academic researchers and the most dynamically engaged activists that one could ever imagine. And the other feature of the project that we agreed upon right from the beginning was that our priority would be developing communities of interest in the locations where the project emerged. And what this has meant is that we've been able to cultivate really quite unique research agendas for each of the locations, and actually it provides us with the opportunity also of celebrating the skills, the real skills of INSP and organizations. I wouldn't say like it, because in each city there are different skill sets that are being supported. And the exciting thing for me is that no matter whether this project, Cities Changing Diabetes, lasts 1 year or 30 years, it's allowed for these communities of interest to emerge, and it's made it possible for us to conceptualize new ways of thinking about the challenge of non-communicable diseases and urban diabetes in particular, which is a problem that no one else seems to have a very good answer to. So we're happy to meet new people who have great ideas.